Okay, so I think it is bang on 4:30, 16:30 GMT for those who are coming from abroad. If I could hear from a few people where you are coming from, which countries, it'd be interesting to see how many countries we've got represented on the call. So just chat through, for those, just to let us know where you're coming from. Oh, we've got California, London, Lisbon, quite an international event. Excellent. So quite a few from London, Switzerland, Soho in London. So that's fantastic. Berlin, Exmouth, Yorkshire. So we're getting the regions now. Connecticut, Suffolk, Warwick. Fantastic. So we're getting people coming through, which is excellent. Manchester. So I'm just going to ask if we could just proceed to the next slide, if that's okay. So I will just kick off before I hand over for our keynote presentation from Andy Briggs. I wanted just to mention just a few words of how we've got to this point. Hugely exciting that we've reached this point. And we're doing this in association with Longevity Week, which of course is taking place this week, and Mad World. And of course, we have Claire Farrell, who will be talking in this launch event a little bit later on. So this is really to essentially launch Business for Health. Business-led coalition that was set up actually as a recommendation, came out of a recommendation for from the Health of the Nation strategy from the All-Party Parliamentary Group to focus on delivering 5 extra years of healthy life expectancy while minimizing health inequalities. And so we'll go through in detail, but of course a big focus of what we're trying to do with this coalition is to do our bit to enhance health and economic resilience as we're coming out of COVID. So we will hear from all of our founding directors, from our partners, of what the Business for Health will be doing in the upcoming period. And of course, it's supported by government, backed by the UK Longevity Council, and of course the Industrial Strategy Aging Society Grand Challenge. And we're really, really pleased that we're coming together to look at how we can do more to build overall health and economic resilience. So I think I can see that we're coming, I think we're getting more and more people through. If I could just go to the next slide, just so I can take you through the broad agenda. So essentially the hour will roll out like this. And I do encourage people who would like to ask us questions. When we sort of ended about 5:10, we've got about 20 minutes hopefully for questions. Please do use the Q&A function to send us your questions, as many as possible. We really are here to answer your questions. I know the word is out that this has been bubbling away, but we just want to make sure that this is the opportunity for you to ask questions of us. So you can see that after a keynote presentation, we have a couple of others. We then have a more sort of general conversation about collaboration, and then with the Q&A. So with that, I'm going to hand over to our first speaker. I'm very, very delighted that Andy Briggs is here with us today. Of course, he is the CEO of the Phoenix Group, one of our founding partners, the co-chair of the Longevity Council, and also the trade ambassador for healthy aging at the Department for International Trade. So I'd like to hand over to Andy, who will take us through the next 10 minutes. Andy.
Fantastic, Tina. Thank you very much indeed. And thank you very much for inviting me to be here today. I'm absolutely delighted to be here at the launch of Business for Health. Can everyone hear me okay?
Yes, we can. Excellent.
Fantastic. Great. Well, I mean, Longevity Week this year, I think there's a particular resonance coming in the midst of a second lockdown. It also comes in the same week as Pfizer's vaccine announcement. And that vaccine development clearly gives us hope that there's an end to this horrible pandemic, or certainly that's feasible. I think, but it also shows the remarkable achievements in health innovation that are possible. As Tina just said, my day job is as the Group CEO of Phoenix Group. We're the UK's largest long-term savings and retirement business, and our company purpose is to enable our customers to enjoy a secure and sustainable future. In the UK, as in the rest of the developed world, our society is ageing, and this purpose becomes more important than ever. And it's from this deeply held conviction that I started working with our government on understanding the importance of longevity and the opportunity it presents. So I'm the government's business champion for the Age Grand Challenge and for older workers. But within the Age Grand Challenge, the key goal is to enable an extra 5 years of healthy life expectancy. It seems to me longevity is a good thing, and we're getting more of it. These increases in life expectancy are to be celebrated, but they aren't enough on their own. While life expectancy has steadily increased, healthy life expectancy has not kept up. And we all need to be more concerned about healthy aging. Our economy, our growth and productivity depend on a healthy nation. Our belief in the importance of a healthy nation is why Phoenix is proud to be a founding member of Business for Health. And I'd like to spend a few minutes on why the longevity economy and healthy aging as a business opportunity add up. And there are 3 elements I'd like to talk about. First, the longevity trend. Second, the business opportunity. And then in conclusion, why Business for Health is important. Sorry, I've got a message here saying they want me to start my video. But I think my video is working. Is my video working?
It is now.
Yes, we can see you now.
Great. Apologies for that. I didn't realise I was meant to do that. So sorry. First of all, longevity. In the UK, we have more people aged over 65 than we have under the age of 5. And this means we need to invert the focus that has traditionally been in place. For me, it's a huge benefit that childhood mortality has decreased so dramatically in the last century. Life expectancy at birth has broadly doubled over that period. And UK longevity is predicted to continue on the trajectory that we've seen for the past 50 years. Over a quarter of people born today can expect to live to age 100. And the increase in life expectancy is to be celebrated, but it's not enough on its own, because, as I say, we must focus on healthy aging, and that is our focus today. The increase in numerical life expectancy has not been matched by an increase in healthy life expectancy. An example of that, 10 years ago, a man in poor health could expect to live a little over 8 years. And that has only changed marginally over the last decade. And that represents the challenge I think we need to face into here. The second area I want to talk about is the business opportunity. Innovative ways of improving the experience of aging is of ever increasing importance, in my view. Importance to the economy, to society, and to each of us individually. We will all benefit from an increase in healthy life expectancy. The UK is already focused in this area, and I think we are well placed to succeed. We have the digital infrastructure in place. We have the significant advantage that a single health system gives, and we have proven success stories and a society that is looking for solutions. There is a saying, youth is wasted on the young. I'm not really that sure I agree with that. But another saying I hear people say is wealth is wasted on pensioners. I completely disagree with that. The global spending power of the over 60s has reached $15 trillion a year. It's hard to get your head around trillions, but $15 trillion a year is the global spending power of over 50s. That is nearly 6 times the entire UK GDP. The next decade will see a huge growth in consumption by older people, if only in line with the increase of the size of this cohort. Spending by older consumers is already predicted to rise from about 55% of total consumer spending today to about 65% in the next 20 years. However, there's a much greater opportunity here. There are already 1 million millionaire pensioners in the UK today, and that figure will grow. In the UK, our over 65s do not spend their income. Overall, their savings are increasing. In the city of Manchester alone, the over 65s is just one city in the UK. The over 65s are saving £1.8 billion a year. And yet we know that health is both a significant concern and a priority for this group. So the UK lacks the range of solutions. Bring these two things together, this level of wealth and saving by the over 65s and their concern for their health and the priority that has, and come up with the right solutions, and there's a fantastic opportunity for businesses here. If the UK tackles the barriers to the spending of the over 75s, then in the next 5 years, we could add 2% to UK GDP. Put another way, if the over 75s match the spending of those aged 65 to 75, sorry, so if the over 75s spent at the same rate as those aged 60 to 75, we could add 8% to GDP over the next 20 years. And the key to unlocking this opportunity is to enable healthy aging. The focus on healthy aging innovation is more important now than at any time in our history. The opportunity for healthy aging innovation is more important now than at any time. As I look forward, a key lesson for COVID will be the need for a greater focus on health. And I guess the government's backing of Business for Health, and indeed my role as the government business champion and their backing of that, is evidence of this focus. So in conclusion, a focus on healthy aging adds up. This is where the importance of Business for Health comes in, and I'm delighted to be with you here today, and that my company Phoenix is one of the founder sponsors, along with many others, of this fantastic initiative. Employers, investors, innovators can all benefit from focusing on healthy aging, and Business for Health will promote good business practice and bring us together. This focus and progress on the agenda is more important now than ever, and I personally look forward to working with all of you going forward on this critical area. Back to you, Tina. Thank you.
Thanks, Andy. I know you have to head off a little bit later into the program, but I've got a question here because we've got a couple of minutes before we need to pull in Andy McClure. We've got a question here that says, or asks, what is your practical advice for companies with solutions in healthy aging to take advantage of these business opportunities that you describe? Which UK organizations offer a dedicated front door? And perhaps you can speak to the UK export potential as well.
Yes, so I think I think one of the key issues is that the right sort of products and propositions aren't available and in place, and so it really is. My primary advice would be that organisations focus on this segment, get under the skin of understanding the needs of this segment, and think about the propositions that would meet their needs. In my experience, when people start to think about innovation, that they immediately tend to go towards millennials and thinking about the needs of millennials. And basically, while digital solutions and innovative proposition development techniques are fantastic and are critical in any sector of the market, I don't think people look hard enough at the hard facts that today 55% of consumer spending in the UK is done by the over 65. So I would say the biggest gap is in having the right propositions. I mean, it's a simple example, and probably slightly more aimed at a slightly older cohort, but people want to stay in their own homes, for example, and they don't want to go into care homes. They'd much rather generally stay in their own homes. Often their homes need modifications. If you try and buy handrails to go around your home, for example, you get very large, chunky, plastic-looking things. A lot of people don't want those in their homes. Organisations aren't making tasteful home furnishings to make a home safer, as an example, and therefore there isn't the kind of demand. People don't buy them because they don't like the look of the product. So that's where I would really get people focused. The money is there if they come up with the right propositions.
Absolutely. Fantastic. No, that's fantastic. So so I'm just looking, yes, so we've got another question here, which again, I might just ask you before we bring on Andy. We've discussed the role of structural societal inequalities in poor aging with health a lot, indeed being critical to increasing healthy life expectancy with the Marmot Review, for example, as well as the need for growth that is sustainable, green recovery. Could you comment on how we can build this in?
So I didn't quite catch the first part of the question there, Tina. Did you say?
So we've discussed the role of structural societal inequalities in poor aging with health a lot. I mean, this is generally, indeed, being critical to increasing healthy life expectancy vis-a-vis the Marmot Review, as well as the need for growth that is sustainable. Could you comment on how we can build this in?
Yeah, I mean, I think it's there's undoubtedly a strong correlation, between the if you like, the wealth segments and the health in aging. I mean, ultimately, I think what's kind of critical to that is to get to that earlier. And I think in the UK market, auto enrolment is one of the the major things we've done there. In the UK, we had about 10 million of the 30 million people in employment in the UK were making savings towards their retirement. Post auto enrolment, we now have 20 million. Because I think when you're thinking about the 65 plus year olds, it really is getting in earlier to get that pension saving in place that will make the difference. I mean, beyond that, ultimately, we still need to then, in thinking about the over 65s, think about the different segments and the needs of those different segments in terms of the products and services that are developed. And the less well off will probably have some differences in their needs compared to others. So in the same way as an organisation would think about segmenting its target customers into different segments, the same approach should apply here.
Yes, and again, because we're getting quite a lot of questions through here, and I just want to capture you before we lose you. There's a lot of talk about the business models having to change, and of course, looking at the business models that make sure that we do not widen health inequality. Perhaps comment on sort of socially responsible sort of investment, that where that's going to go.
Yeah, I mean, I think it's absolutely essential, and I think organisations that don't embrace sustainability, holistically across their organisations in all aspects, be that their own impact on the environment, be that any organisation that is investing, that they have very strong responsible investment principles around that, be that developing sustainable propositions from a customer perspective, and indeed what they do in their own organisations, diversity and all the approaches they take with their own colleagues. Organisations that don't become strong in all those areas, what will happen is the talent will go and work elsewhere. Shareholders will sell the shares and buy the shares in the organisations that are stronger from a sustainability perspective, and customers will go elsewhere. So I think it's absolutely essential that any business really does embrace all those aspects of sustainability and look to be a leader. Those that don't will get left behind. They will lose their customers, lose their staff, lose their investors. And to be honest, I think that the pandemic is just going to further exacerbate. I mean, if you'd have said to us, 12 months ago that we all would week in, week out have stood on our doorsteps at 8 o'clock in the evening, clapping, one of the least well-paid sectors of our society, I don't think many of us would have imagined that would have been happening nationwide across the country. And I think it just says how all of our priorities and perspectives have been changed by this pandemic, and I think sustainability is at the core of that.
Absolutely. Thank you so much, Andy. That's really, really fantastic. And we've covered quite a lot of ground already, and really pleased that we're seeing the questions flowing. So we're going to have no problem having enough questions to answer. So I will save a few of them until further into the event. So thanks, Andy, so much. So I'm going to bring in our other Andy, Andy McClure, who is the Marketing Propositions Director at AXA Health, to take stage now. Thanks, Andy. Over to you.
All right. Thank you. I'm being told I'm unable to start the video, but hopefully you can hear me, Tina?
I can certainly hear you, and I will ask James to help start your video. There you go.
There we go. All right. And my technical skills don't match yours. I can't have the background. Sorry about that. Well, look, following the other Andy and yourself, Tina, can I just start by adding my thanks on behalf of AXA Health to the two of you and all the other people who've gotten us to this point. Look, the view that we've got at AXA Health is to create something like this from simply a recommendation in a report a couple of months ago, to do it at a time like this with everything else that's going on, and to remain focused on the purpose and the intent of the work here. It's really quite extraordinary. It's quite special. So just for me personally and for the wider group, Tina, Andy, and the rest of the gang, thank you so much for helping us get to this point.
Absolutely.
I think I've been asked to speak here almost, I'm the business in business for health, if you will, in this little presentation. So let me just introduce AXA Health. Until about a month ago, you might have known us as AXA PPP Healthcare. We're one of the leading private healthcare insurers in the UK, part of a larger global group. And we've set ourselves this lofty mission of helping our members be the best version of themselves, whatever that means to them. And for us, getting into business for health and working with Tina, with Andy and others, is trying to take concrete steps to expand that mission. So it's not just for our customers, but rather it's a slightly larger game that we'd like to contribute to. Now, my colleagues, speaking to them and telling them about this, they believe in health, they believe in well-being, they believe in helping each other, they believe in 8 o'clock standing out the front of the house banging their pots and pans. These are the people I work with. We believe in helping our customers feeling better, feeling fitter, getting healthier. And even our current advertising campaign that we're pushing out is all about that kind of sense of feel-good health. So for us, this seems to sit very close to our heart, what we want to be. We want to be the kind of company that is part of business for health. And for us, at the core of it, if I kind of try and pull out some of the elements of it, the core for me is this simple idea: prevention is better than cure. Okay, prevention is better than cure. I'm sure the people on this call know better than me some of the statistics that 9 out of 10 bowel cancer patients survive for more than 5 years if detected in the early stages. Cancer research has a host of these kind of statistics online. Similar numbers for breast cancer, ovarian cancer. It's clear early detection is critical, which I take to mean prevention is better than cure. And building on Andy's point, trying to help people have that longevity, give them that sense of health going into their 60s, their 70s and beyond. That's that fundamental idea of how do we give people that sense of healthiness, of fitness, of giving them healthy lifestyles, not smoking, eating well. I'm as guilty as any of us at the moment. I stay locked to this desk. How do I get away from the desk, away from the computer? How do I get a good night's stretch? How do I even or a good night's sleep rather, and how do I even find time to stretch? And it's all basically this fundamental idea: prevention better than cure. Huge amount of work that's being done by AXA Health at the moment for our customers is focused in this kind of area. We have risk managers going out to clients even now, trying to help with the number of accidents, the number of incidents that happen in the workplace and at people's homes. Occupational nurses going out to homes, helping people with their seating or with their setup. And even going further, working with companies on underlying well-being programs where they are recognizing, as much as we are, that the companies we're finding that have very strong well-being programs, they're growing faster, they're adding value to the bottom line. It's something to do with the morale, it's something to do with the engagement, it's even simply something to do with the sickness and illness that people have. Companies with healthier, happier people grow faster. Again, it builds, Tina, perhaps on some of the points you were making on sustainability. And that, again, is what we're trying to do within AXA Health. We're looking not just at the healthcare and the hospital and paying for the bills whenever somebody has to have a surgery. It's the well-being. It's the coaching. It's the counseling. It's helping people with behavior change and with behavioral science, and simply trying to help our members behave better, be healthier, be better versions of themselves. And this is what kind of underpins why we're trying to work with Tina with Business for Health. And simply, it's this idea. We believe that prevention is better than cure. And we'd like to do that, not just for our members, to see what can we offer to broader society. Now, we believe, talking to my customers and to my CEO, businesses have a moral responsibility to help the societies within which we sit. We don't sit apart from society. I hope the fellow people from business on this call don't mind me saying that. We're part of society. We're part of the fabric. So the philosophy that we're bringing to our members, we want to find ways of extending that. We want to find ways of reaching beyond the people who actually pay for it. Can we offer it out more broadly and help society get fitter, healthier, have that healthier long-term lifespan? And the great thing, bringing it back into my company, into AXA Health, and I'm sure it's similar for other people's company, that gives us a sense of purpose and a sense of mission, a sense of kind of doing good. It gives us a chance to have a positive impact on the world around us. And, at a time like this, with everything that's happening, that's an amazing opportunity that we can offer to people, to contribute, to have a positive impact, to help. And I hope in some small way, AXA Health, my colleagues and I, we can have some small difference or offer some kind of small difference to this. But basically, we're just delighted to be here. We're happy to help in some small, humble way. And with that, Tina, if I can pass it back to you with my gratitude.
Oh, thank you so much, Andy. And thank you so much for your kind and positive praise and encouragement. There's so much that we need to do ahead, and we need to collaborate. And I think it's great we've got this wonderful group already coming together. We've got more and more questions coming. Do keep firing them through, our audience, please. So we've got some interesting questions which will definitely enrich our discussion at the end. So I'd like to hand over now to Claire, Claire Farrow, who's the director of Make a Difference Summit. And she has just come out of a very, very busy period. She's one of our strategic partners for Business for Health. And she's just come out of a very busy period running these fabulous summits on employer sort of health and well-being. And so I'm going to hand over to Claire, who can tell us some of her core insights from having just gone through an international sort of round of events in the last month, some of her key insights. Over to you, Claire, and thank you so much.
Thanks very much, Tina, and good afternoon, everybody. At Make a Difference Media and Mad World, we believe that mental health and wellbeing should be everybody's business. And so we're delighted to be collaborating with Tina Woods and the rest of the team on the Business for Health initiative. As Tina said, my name's Claire Farrow. I'm the head of content for Make a Difference Media, website, newsletter, and the Mad World Summit. We provide the global learning space online and hopefully one day in person again soon. For employers looking to adopt, embed and evolve inclusive strategies that will have a sustainable impact on workplace culture, mental health and well-being. It's my job to keep my finger on the pulse of employers' information needs, as well as to stay ahead of what's new and next in the world of workplace well-being. So there's a tremendous synergy between what we're doing and what Tina Woods and the Business for Health initiative are doing. We look at the future of work and business through the lens of mental health and well-being, but we recognise that you can't have mental well-being without physical, financial and social well-being. As Sir Ian Cheshire said at the opening keynote at our very first Mad World Summit, the workplace is a force for good in mental well-being. Business has to play its part and be confident about playing its part. This was true back in 2018, and as a result of the pandemic, it seems to be truer than ever. COVID-19 has acted as a catalyst, bringing mental health and well-being to the fore for businesses, but there's still so much more we need to do. And it's also shown up the tremendous health inequalities in the country. Business definitely needs to step up. We need to make sure that employee mental health and well-being are put at the heart of post-pandemic recovery. So I'm very briefly going to outline 3 of the key calls to action for employers based on conversations I've been having, as well as Tina said, insights from the last events that we've just been running. And I believe these will really make a difference on this agenda. So the first is, it's great to see employers buying into this, but we need more leaders to buy in and move beyond talk to action. Business in the Community's most recent mental health at work survey found that only 37% of employees felt supported by CEOs and boards. So it's clear that more work needs to be done. The business case has been made, so what's stopping them? We need more leaders to talk about the tangible business benefits, I think, as well as the human benefits that they're seeing as a result of investing in employee mental health and well-being. Andy just touched about or talked about some of them there that they're experiencing at AXA. We need more of the businesses that are seeing these benefits to talk openly about those benefits. It's about marrying head and heart, hard data and storytelling. We also need to have honest conversations with leaders around what's preventing them from embracing this agenda. Then we can tackle their concerns directly. My second call to action is that we need to keep shifting the narrative around mental health so that mental well-being becomes aspirational. And we need to encourage employers to find the language that resonates with their colleagues around the topic. So we've got the leaders and we've got the language. What will we apply that to? My final call to action is that we need employers to embed inclusive wellbeing programs into their organisations that ensure they're addressing the systemic root causes of poor mental health and not just going for the low-hanging fruit. To do this, they need to assess needs as well as impact. They need to look at the organisation as well as the individual, addressing things like job design and management capabilities. Looking at how well-being can be built into development plans, as Unilever are doing, and linked to performance management, as Companies House are doing. There are lots of great examples out there. It also means putting attention on prevention, as Andy from AXA has mentioned. Moving forward, we believe there'll be increasing pressure, quite rightly, from customers, shareholders, investors, and leadership themselves to deliver on the role that industry has to play in a fit, happy, healthy population. Our role is to bring more and more employers into this conversation, to understand their evolving information needs, to continue signposting them, and to source and share best practice case studies that will make this vision a reality. I welcome any suggestions you might have.
Thank you so much, Claire. That was fantastic. And yes, and some key points, some themes that very much resonate and which we can build on, obviously moving forward in the coalition. And of course, the prevention is very much at the heart of a lot of this as well. So thank you so much, Claire. I'm going to hand over to John Godfrey, who is again one of our is one of the founding directors and indeed the chair of the Business for Health. And I will hand over to you to tell us a little bit about what we'll be doing in the next year ahead. Over to you, John.
Well, thank you very much, Tina, and thank you very much to everybody else who have shared some really inspiring thoughts with us this afternoon for our launch. Both Andy's and Claire. The start point really of Business for Health is that health equals wealth, and health is everybody's business, and it's business's business. So this is immensely important to us. Andy has talked a little bit, and Andy Briggs talked a little bit about the immense business opportunities. Oh, sorry, have you stopped my video, Tina?
No, we can see you.
You can see me. All right. So I'm getting a little alert saying you cannot start your video. But
at least
if it's working, it's working. Okay, great. I will carry on. Just wave at me if something goes wrong. Health equals wealth, and this was absolutely proved beyond doubt by the COVID experience. We saw the economic damage. So the converse of that is that it is in business's interest to promote a healthy living agenda, and in particular, extra years of healthy life expectancy. You know, quite simply, if we have more healthy people, you have more people working productively, more people wanting to join firms that promote this, and I think that was a key bit of Andy McClure's message. And we also have more people buying and consuming products and services that business create. So there is a very hard-headed message for doing this. And, you know, we'd started down this track with Jeff Vilkin and others thinking about what business could contribute to a health agenda. And we've now spun off from the report, which was commissioned by the APPG, and we're now going to put that into practice. So I guess the question is, what do we do in year one? How do we start on this? And we've picked up in particular one suggestion, which is to create an index. And we've sort of drawn a lesson here a little bit from the climate world, where one of the things that has enabled that to really take off and to move forward is greater emerging agreement on how you measure it, because what gets measured in business tends to get done. So we want to develop a usable, workable, meaningful index that is also simple and enables businesses to judge what progress they're making. It's not about historical naming and shaming. It's about what progress we're going to make as businesses. And that's a fairly major piece of work. Along the way, you know, we shouldn't underestimate the complexity of it, but along the way, there will be other areas that we can have deep dives into, which will include how we work as employers, you know, how we redesign products and services that encourage health. How do we transition away from promotion or the production of unhealthy things towards more healthy things? So all of this will be incredibly valuable. What we want to do, and Andy Briggs sort of alluded to this, is we want to help businesses be sustainable, because in due course, this will become part of ESG investing. And again, a bit like the climate world, we want to avoid businesses facing into a world of risk where they have the equivalent of stranded assets, but this time around health, not carbon. And they find investors moving away and their businesses being damaged in consequence. So this should help businesses to help themselves if they work alongside us with this agenda. So this is a very business-friendly and a business-led initiative. And along the way, what we would like to see is more people coming on board to help us. And people can do that as founder members and sponsors, as we are, and as Phoenix is, and AXA and others. But we also have space for people to come on board with help in kind, with support in kind through intellectual property, other services that they may be able to offer, and just as broader supporters with expertise to contribute. So we want to make this an organization that, a wide range of different businesses can contribute to in different ways and work alongside academics and the third sector, because that's how we'll get a lot done. And this will be an open access project and an open network for people who want to gain from it as well as contribute to it. So the first thing is to grow bigger. The immediate focus over the next year will be the production of an index and really good metrics, which will help us produce better products and services and hire people, make people keener to join our organizations. And that way we can move forward with this massively important agenda. People talk all the time about build back better after COVID. Build back better tends to be about decarbonization and about infrastructure, but absolutely at the head of that list, we have to have health as well. And that includes physical health, and Claire, mental health, absolutely. Just to give you one final thought on the scale of what we're trying to do. Some years ago, I was lucky enough to be able to commission Dennis Stevenson and Paul Farmer's report on mental health and what employers could do around it. And Deloitte did some sums, and they worked out that mental ill health costs business somewhere between 33 and 42 billion pounds a year in terms of lost productivity and absences and so on. Physical health, no doubt, is larger. But having measured it, businesses have started to step up to try and do things about it. We need to tackle both, and we need to tackle healthier, longer lives to reduce some of the inequalities we see in our society, which have been spoken about earlier. So I really hope lots of people get on board. Delighted to be here at the launch, and look forward to the discussion for the rest of the afternoon.
Thank you so much, John. And I know what we're going to be doing now is go into a conversation, and I can see a few people who will be very pleased about this, because the notion of collaboration, how important that we see business in context and collaboration with third sector, academia, etc., is so important. And so we're going to essentially ask you, John, to lead a conversation with George McGuinness and Anna Dixon, who of course are also involved in Business for Health on the board, and who are obviously very actively involved in supporting healthy aging. So over to you to talk about collaboration, why it's so important, and what that will actually look like in practice.
Oh, fantastic. I can't at the moment see George or Anna, but I'm sure they're there somewhere.
We're here. Hi, John.
You're there. Hi, Anna. And I did see George earlier, so I'm assuming you're still there.
Yes.
It's fantastic to have you both on board, and you have huge expertise and leadership in this sector. So it's a massive contribution. Just to talk a little bit about collaboration, I'll go first, if I may, to Anna. You've done quite a lot of work on the employer's role, in particular around healthy, longer lives, but also been involved in product design, the sort of thing that Andy Briggs was talking about briefly at the beginning. How do you think we should take this forward, and how broad can we make this coalition?
Well, I mean, it's fantastic that we've got Business for Health launched, and that companies like your own, John, are part of getting this off the ground, because in looking at the huge issue of the changing demographics, what I call the age shift that is upon us, particularly here in the UK, but this is a global issue. It needs business to step up if we're not only going to live longer, but as we've been talking about, live healthier, longer lives. And address and open up that opportunity to everyone. So I think the idea that this is also tackling those health inequalities, and the cost to the economy and business is huge. We see and this is pre-COVID, a huge decline in economic activity rates from sort of 55 on. There's a very, very steady drop. So the year before state pension age here in the UK, about half of people are not actively in work. So if we could close that employment gap between the older workers and those at younger ages, that would be a huge boost to GDP. But we're also losing that talent to the workforce. So obviously, in light of COVID, I think a real key role for businesses to be thinking very carefully about how they manage to retain an age diverse workforce after whatever restructuring or redundancy they have to go through. And so that talent and knowledge and experience isn't lost to business. And also those that start to come back and rehire, that there's also retraining opportunities for people who've got quite a lot left to give in terms of their economic contribution. So yes, this is something that Centre for Ageing Better has been working on with leading employers, and we're really looking forward to supporting members, a growing number, we hope, from a wide range of sectors engaged in business for health in particular.
Fantastic. I'll go to George, but just picking up your point about a wide range of sectors. A lot of people assume that health is about just health providers or the life science industry. I tend to throw in, other sectors. Housing is incredibly important. George, you see the whole sort of business world across the piece. Are there sectors that we need to be focusing on here in particular? Food is a useful one, for example, but how do we do that, and how do we get smaller businesses alongside us as well as just the big names?
Well, a little bit of both. So I think in terms of business focus, one of the areas that I'm delighted that we've seen come forward are service businesses of all sorts who are already out there delivering things. And a view, I think, from the innovation, certainly the government innovation world, that we put a lot of money into inventing stuff that actually often hasn't scaled and spread. So who are the people who are taking those innovations? And if I highlight one example of a company that we're working with, E.ON, the big energy company, are doing exactly what Andy was talking about earlier. They're working with designers to design those grab rails that actually look attractive, to work with kitchen designers over kitchens that work for everyone from someone who's older right through down to their great-grandchild. So really interested in some of those service businesses. How do we get smaller businesses involved? Well, again, we're doing some work on outreach to smaller businesses to help them understand the value to them of actually very often the small business owners themselves are incredibly stressed people running around, and actually starting a conversation with them around their own health, they suddenly realize actually this could be of a much broader benefit to them as a business. Stabilizing their workforce, reducing their recruitment costs, reducing absence and things like that. So it is a very broad landscape, John, and I think there are there's no one silver bullet. So we're working on a whole portfolio of different things.
Good. Well, it's fantastic to have you both on board, and I think maybe one question for both of you, and then I guess I'll hand back to Tina, because I know she wants to open up to the audience. No doubt they'll have questions for you too. I was just going to ask you, what do you think in sort of one sentence is the best quick win we could have for business contributing to better health?
Well, I mean, I think, business has such a critical role. I mean, I think beyond the role of their own workforce, where I think they can make a huge difference, as you've been alluding to, about talking to people and supporting people with their mental and physical health. I didn't say, but one of the leading reasons why those people fall out of work is health conditions, or caring for somebody else who obviously is disabled because of a health issue. So, you know, the loss in terms of absenteeism, presenteeism, productivity. So I think there's a huge win-win to really prioritising the health of their employees first and foremost. But we also, Aging Better, like George, you know, recognise the huge opportunity for getting some of these products and services. So I think there are opportunities, particularly in the housing sector, we see where the innovations now that could really help people. You know, bad housing is having a very detrimental impact on people's health right now, as we go in to hopefully refurbish some of our old housing stock for the purposes of making it more energy efficient from a climate motivation. We have to at the same time be addressing the health damaging effects of our homes, as we highlighted in a recent report with the King's Fund.
Fantastic. And George?
Well, I'd sort of build on that. I think within this arena, that there are huge opportunities for businesses from aging populations. So there's much more that they can do to look internally. What do we offer, and how is that shaped for older people? Who's in our workforce that can help us understand that? And I think you'd find that actually by shaping your product offer, you begin to understand that a lot of that builds around good ideas around health and keeping people in the workforce, as Anna's sort of indicated. So I think businesses can look at this as an opportunity that they should be exploring, and health is a positive byproduct of it.
Terrific. It's an obvious place to look. Tina, I'll hand back to you because I've been seeing lots of questions coming in and comments. So over to you to moderate that. Thank you, George and Anna.
Thanks everyone. So yes, we've got quite a few questions. I'm trying to bunch them into some common themes, because I know we've only got about 15 minutes left, and there's a couple of practical questions which I'll potentially leave to the end. And so Mary and Claire and Andy and obviously George and John and so forth, please just, you know, I'll ask the question, and please feel free to pipe up if you feel you need to, and I'll look for your hands to kind of show that you want to answer too. But the first set of questions is really around this concept of agelessness and intergenerational sort of working, and that's from Susan Flory, who of course is a massive fan and advocate and supporter, and we're very grateful for all the work that she's done in the supporting the community here. And then Simon Warner-Boer, who of course is also part of the community. And so Susan's question is, how can we get big business to embrace the idea of, you know, of shouting loud about the assets of intergen workplaces, ageless employee profiles, publishes badges of honor, she reckons as an idea. And similarly, Simon saying, how can we ensure intergenerational approaches to build up social capital? So who would like to have a go first at answering that question?
Well,
George?
I can dive in. I mean, I think the first thing is age diverse workforces are probably an under-recognized but definitely valuable aspect of a diverse workforce. And the bit that I was alluding to before, that actually older markets are actually a real opportunity. You know, just in terms of the UK, something like 3/4 of the financial wealth of the UK is owned by older people. So firstly, recognizing that age as an aspect of diversity is as important as many of the other aspects of diversity that we now champion. I think others have already mentioned that the positive value of actually the expertise, held by older people, being a benefit to bringing on the next generation. And there are tensions. I mean, I think we particularly recognise as unemployment is set to rise, that there are tensions around enabling the next generation to come in and actually start work. But I think that there is a fundamental case of older people are a valuable part of the workforce.
Anna, would you like to step in? Because I know with the Healthy Aging Consensus Statement, that's, age diversity it's a big part of it, isn't it?
Yes, and I think there's now growing evidence, but it's sort of early days about the performance of age diverse teams, that there are examples now where we see higher sort of team performance where you have an age diverse workforce. And I think, in addition to sort of doing it for those reasons, I think just as part of diversity and inclusion, there's a real onus to be placed on looking at your own data, understanding, who are you hiring, looking really hard at the language and imagery you use in your recruitment, where you recruit from. If you're only using digital channels, you will be excluding some of those older workers who perhaps are coming out of maybe more manual jobs. So I think challenging yourself, who are you promoting, who's getting the training opportunities and leadership opportunities? How do your workforce in their late 50s and 60s feel? Do they feel valued? Are they engaged? And I think you'll be shocked, to be honest, and you'll find that there are issues that need addressing. As we've looked at gender, race, disability, and we see the issues in terms of challenges and barriers that people are facing. And so I think that, that's what we really need, employers to come out and be really honest about that. And we do have champions who have committed to trying to make their workforces more age diverse and address them, and they can speak to the benefits of that. So we do want more, but I think the starting point for every business is to have a look at your own data and really understand how are you treating age as a diversity characteristic.
In some ways, Tina, we might be able, if we get this right, to help more age diverse workforces if the workplace in general terms is going to become more flexible as a result of what happens through COVID.
Definitely.
Certainly, there are perhaps, for example, older people who, really don't feel like having a substantial commute every day, but who might now have a greater opportunity to work from home. It doesn't work for everybody, but there will be generally greater flexibility, and that could help if we get it right.
That's definitely the case. And I think with people with health conditions, which is obviously more common at older ages, the issue there is that people may be sort of finding it harder to go back to work if they have underlying health conditions. So it's not only doing the health and well-being prevention, which we've all talked about and is really key. It's also identifying who has some chronic condition and how you can really support them to manage that so that it doesn't impact their ability to work. Making reasonable adjustments, including flexibility, are absolutely key.
Absolutely. So I'm going to move on to another sort of set of questions which pick up on this whole notion around reframing the conversation. There's quite a few questions actually on the language here. Reframing the conversation from healthy aging to lifelong health management is one from Angela Terrell, who of course we also know, and who supported us at Longevity Leaders actually for our series of roundtables in May, which was fantastic. Initiative. She asked for looking how to engage consumers in fitness, for example, how to engage consumers in fitness activities to build strength and muscle mass as part of their lifestyle at any age could have huge implications for people's physical capacity to stay in their homes as they age, as COVID provided an opportunity to push the narrative of lifelong health improvement. So I might ask Andy McClure actually to answer that question. Andy, would you like to have a go at answering that?
Give it a shot. I think it's something I came across.
Sorry to put you on the spot.
Something I came across recently. I used to live in Singapore for a couple of years, going back a while. They've recently come to the fore. They're one of the first national health services to tie up with, I think it's the Apple Watch, to start gamifying and encouraging people to get out and be more active and win rewards and earn money off vouchers, discounts, etc. So there's interesting technological ways that you can do that. I don't think you have to go down just simply the Apple Watch route to make that happen. I think the other bit, lifting off some of the things that perhaps John was talking about or others around making spaces accessible, getting rid of staircases, allowing people to have easy access around shops, around even town centres, as and when we're allowed to get back into them, there are ways to get rid of what to perhaps healthy people feel like not a problem, but if you've got issues with mobility, become almost insurmountable. So it almost goes back to what the first Andy talked about, perhaps, which is thoughtful, intelligent design of either products, access and distribution, and it's just kept in the mind as another opportunity or another problem to be solved by the designers.
Absolutely. Fantastic, Andy. I'm going to go to another question. There's a couple that are related around, this is a question from Alistair McGregor. As Andy mentioned, purpose and meaning are key requirements of well-being. What should employers be doing to support employees in finding their purpose? And then a specific question to Claire. Are there any specific well-being metrics or measures that you would recommend for inclusion in performance management process? You mentioned Unilever. So Claire, can I ask you to answer that last question?
So specific metrics around
specific well-being measures, metrics that you would recommend for inclusion in performance management. Because you mentioned some good examples. Unilever, I don't know how they're approaching it, and whether there are any. You mentioned development plans, for example. Whether there are any other examples from employers about how they incorporate well-being measures and metrics into their approach.
Yeah, sure. I mean, I think that there's kind of two questions there. There are different ways of measuring, well-being, and there are different metrics that people use. And actually, Andy touched on some of those before. They can be, related to reduced sickness and absence. You can measure presenteeism, even. You can, look at engagement levels, retention levels. All of those metrics can be useful. You can have specific surveys as well, which are well-being surveys. People are doing pulse surveys, using those with different questions in them. If you have the same question in several surveys, you can see how opinions are changing. The metrics around performance management that's quite specific. So Unilever have got a really great approach, but it's sort of completely embedded. It's not only around metrics, it's embedded into their systems and their processes, and their leadership requirements. So I don't think you can, there'd be KPIs against leadership or performance related to mental health and well-being, and how they're approaching the well-being of the people that report to them. So that's how you would approach that. But I mean, I'd be happy to share a bit more detail with the person who asked the question afterwards, if that would be useful.
Fantastic. Thank you so much.
We've got some case studies on the website as well.
Well, and this goes back to, I know one of the things that we want to build up is this portfolio of case studies. And of course, we'll be very pleased to pick up with you on that, because there's so many good examples that we can learn from. So there's a question to both John and George about that Innovate UK doesn't seem to be interested in funding innovation that increases efficiency and reduces cost and effort to get things done. Indeed, successful prevention in healthcare would lead to a drop in demand for services, but greater cost savings elsewhere. Do you want to comment on that? That's a question to both you and to John and George, whether that's.
Yes, and I'm not going to comment on the specifics because I don't actually know them. What I would say firstly is part of what shaped the thinking for the work that I'm doing, which is actually when you're developing an innovation that is to be funded by the health service, you're competing with an awful lot of other things, and it's actually incredibly difficult to extract the, if you like, the payment from one area or the savings in one area to pay for another area, because often there are other pressures as well. And I think that's why when we set off now a year and a half ago, we were really interested in trying to understand what are the sustainable business models that people can develop and pursue that are out there that would allow a business to grow. And I think that's one of the lenses that people look at when they see innovations coming through. It's also why we're really keen on businesses, because I think there are markets out there that are underserved and underdeveloped. And sort of linking back to, I think it was Angela's question before around the intergenerational piece, aging specials have traditionally focused on too small a segment at too high a need. And actually, if we were thinking more generally. And I think some of the examples that John gave about architectural design, you would find that actually really good architectural design, inclusive design, works for many more people. So it's not that we're not interested in funding those sorts of innovations. Mr. Anonymous attendee, apologies, I don't know who you are, but it is because we're really keen to make sure that there's a good chance of success for the businesses that we fund.
Any quick comment on that, John?
Well, I think that's a very well made point, actually, by George, about the competition for resources if you're trying to market something into the health service. But I think there are huge spaces available and support available for things which reduce demand. And if I think, for example, around how do you keep people who are on a journey which will require increasing amounts of care, how do you enable them to remain at a lower level of acuity for longer and therefore require less institutional care, put off the point of residential care and age in place? I think that is a really useful market for people to play into. But I'll stop there because we're pressed for time, I think, Tina, aren't we?
We are, and on that point, we're actually 1 minute over on time. So I'm just going to pick up on a practical question, and then we'll close. And I'll thank everybody. There's a couple of questions on how to join. So and if there's a cost. So so just to pick up very quickly on that, after this event, we'll be sending around an email in terms, to collect interest in joining our register. Now, there's a couple of different. We're very inclusive. We don't want to turn away anybody on account of cost. And there are ways in which, and I think, John, you'd mentioned in-kind contributions. So there are different ways to participate. There's various levels of membership fees, which, we can write to you about as well. For a nominal amount, you can then get branding, collateral and things like that. But we really are inclusive. We don't want to turn away. And of course, the power and what we're trying to do will come from involving as many people as possible. So, so that's that point. And I think you haven't been able to cover all the questions, but I hope we've covered a nice smattering of some of the areas of focus that the Business for Health Coalition will focus on. But we'll send around a note, obviously, afterwards, and please do get in touch. And of course, we have a website, there's a contact page, indeed, all the links are there, which is businessforhealth.org. So please just have a browse on the website, fill in, either sign up to our register, drop us a note, it's all there. And we really look forward to working with all of you ahead. Obviously, it's early days. This is, but we're looking for cross-sector representation, across the different sectors that all have a huge role to play. So we really are looking, big and small. We want to hear from you. So thank you to everyone, all of our founding members, our partners, and of course the community who've joined us today. Thank you so much. And I will close, and that's it.
Thank you, Tina.
Thank you, Tina, for organising it.
Thank you. And thanks to our partner MadWorld for providing the support as well on this call today.
Pleasure.
Thank you so much.
Thank you, everybody.
Thanks. Bye.
Bye.